A very hearty good afternoon. We are glad to have Dr. Anshu Raina among us today to help us understand the topic adolescent PCOD. PCOD affects women during their reproductive age, sometimes occurring in young girls that are unaware of the disorder and its ill effect. Affects like difficulty in maintaining healthy weight, getting acne, high blood pressure, mood swings, or irregular periods. If a woman experiences any symptoms, the first thing she should do is consult a gynecologist. That's why we are lucky to have Dr. Anshu to guide us on the topic. Doctor, you have the stage.
Thank you, Nikita. Myself, Dr. Anshu Raina. I'm a senior consultant and heading a department of obstetrics and gynecology at Apollo Cradle Hospital, Greater Noida. So today I'm going to tell you about a very, very important and like a burning kind of topic as per we gynecologist is adolescent PCOD. So, what is adolescent PCOD? What exactly the PCOD terms means? That is little important. Most of the time, the girls are nowadays aware about this terminology, but still, I wanted to emphasize what is the PCOD. PCOD is a polycystic ovarian disease. It's a hormonal disorder which affecting a reproductive age group of patient usually, but nowadays it's very very common in adolescents. Why today I chose this topic? Because once we will able to stop this disease on an adolescent age, it will be easier to manage in a later part. And if it will be stopped at this moment, so the less women will be affected with the PCOD in their reproductive age group, which really affects their fertile period or reproduction. So, first of all, I just wanted to tell you what it is exactly. It is a common hormonal problem affecting a woman of reproductive age group, usually, which is characterized by irregular periods, weight gain, adolescent, that acne, unwanted hair growth, the places where you don't want a hair that used to be hair, that is called hirsutism, and usually it happens because of the your ovary produces a multiple cyst, small cyst instead of a one mature egg, which ideally to be produced by the ovary. So from that level, the hormonal disturbances is started, and it takes a form of different manifestations, and it can occur in a different manifestation, and that causes the symptoms like a weight gain, irregular periods, abnormal hair growth, acne, alopecia, that is loss of hair, excessive hair fall. So hyperpigmentation, your thickening, your the underarms, neck areas, under nape of neck, these the darkening of a skin. So these are the common symptoms and features which usually patient present with us, and these are the things which you have to be careful. You should not things ignore these things. So that means you have to visit your doctor if anytime you feel all these things happening in you, because it can happen in adult in the reproductive age group. But today's topic for the adolescent girls, for them, when and how to approach a doctor at what time. So the incidence in India of adolescent PCOD is as high you can think of. It's a 2 in a 10 adolescent girl is facing this disease, and that you can understand how common it is. And it's more common in an urban setup like cities, the metropolitan cities, where because of the incidence is rising due to a better diagnostic modalities and overt awareness. Sometimes because of it's not like that, it was not in a society previously, but nowadays we used to investigate a patient. Because of the awareness of the patient itself, we are able to diagnose earlier, and the earlier it will be diagnosed, the treatment used to be easy. So only the lifestyle changes can treat the things, which I will cover in later part of my talk. So incidence, as I said, it 20% among adolescent girl in India, and where the only the 10 to 15% of women of reproductive age group is only affected. So it's we can say it's more than the reproductive age group. So we have to more focus on a adolescent girl. That is the reason we have to focus, and that is the reason of choosing a topic of this today for the general awareness talk. So what exactly causing this disease? You should aware about why it's happening, why it was not there previously, and why it's happening rampantly nowadays. So because of the it's increasing incidence, it's happening because of the environmental factor, changing lifestyle of the modern society, academic load which is there in a definitely in a kids, which is less time to go for outdoor activities because of their it's more common in the urban because of the traveling time is more for school timings and all. They are not able to spend a time on outdoor activities and sports and all. So basically these are the factor which is responsible for increasing incidence. Apart from that, there is definitely there is a genetic factor which is responsible. If mother was a patient of a polycystic ovarian disease, say she faced during her adolescent time or during their reproductive age group the irregular periods or the similar symptoms like abnormal hair growth and the irregular periods, the too much of pain during periods and excess weight gain. So these genetic factor also is responsible in their girl child. So apart from that, persistence of hyperinsulinemia used to be there in a child, which used to be ignored. Sometimes if we feel kid is very chubby, it's good, she's a chubby kid. It's not like that. You have to focus why she is gaining a weight and why her weight is on a higher side irrespective of her diet. So that means that child must be having the persistence of hyperinsulinemia, which should not be there. And you have to be careful for that girl child, especially to in view of in and just keeping in your mind that she might land up with the hormonal disbalance in the later part of life. So you have to be more careful and you have to come to a doctor and meet your gynec regarding her problem of weight gain. So these are the small things which can be taken care by a parent, and it can be stopped at this moment because nowadays the PCOD is very common one in every OPD outdoor patient. Every day we used to just see minimum of 3 to 5% of patient of the PCOD. So you can understand how common it is, and the most of the time the patient present in their reproductive age group when they are not able to conceive, when they are planning for their children family and they are not able to conceive, then they used to visit a gynec and then they diagnosed as a PCOD and then treatment started, which used to be little late for that particular patient. So the journey usually starts 10 years earlier, that is in adolescence. And if we will able to stop the disease process at that point, then it will be easier to treat our patient, and it will be good for a patient to not to go on a complication related with the PCOD. So how you will think you I am having or I am going my kid is going through a PCOD. So what are the symptoms you should expect when you have to visit your doctor? You usually the symptoms started with irregular periods, acne, hirsutism, that I said, abnormal hair growth on unwanted hair growth on unwanted places, alopecia, that is a loss of hair on your the excessive hair fall from your head. Apart from that, the obesity is the one of a thing which is noticeable in these children. So nowadays the children of that age group, you will see that they are on a higher side of weight. So anytime you feel your girl child is gaining weight irrespective of their diet intake, the dietary sources and all, so then you have to be little careful about their why she is gaining weight, and you have to visit your doctor. She should be get checked about their hormonal parameters and all the parameters related with the PCOD. So these are the symptoms, and how you will be what are the diagnostic criteria. Usually the patient present with the in our OPD in adolescent age group with the irregular menses. Sometimes the patient used to come, so she started her period, that is called the starting of period is called menarche, which is started 1 year back, and now she is not having her cycle regular. So usually moms come with their girl child and they used to say, why she is not having their regular periods. So that is absolutely normal. If within a 1 or 2 years of starting a periods, if the cycle is not regular, there is nothing to worry. You have to still wait. Obviously, if she is having erratic kind of bleeding or too much of bleeding and prolonged bleeding, then definitely you have to visit your doctor. But if her cycle is coming on some late interval or erratic, not coming every month, every 3 months, 4 months, like that it's coming, or it's lasting for a 4 to 5 days and it goes back, then nothing to worry. Still you have to wait, but definitely you have to see simultaneous. There should not be another features related. As I said, there should not be a weight gain, there should not be a excessive hair fall or acne or abnormal hair growth. If these features are there associated with the irregular menses, then definitely you have to visit a doctor early. Otherwise you can definitely wait for 1 or 2 years too, because this much of time is required to settle down your normal axis, that is called a hypothalamic pituitary axis. The body used to adjust with all these things, and it takes usually 1 year to 2 year time. And once it will be established, this cycle, this axis used to establish, then ideally we should expect the periods regularity should be there. So we have to, once the patient is patient have all these symptoms, they used to come to our clinic. What is the diagnostic criteria by which we can say yes, this girl is having PCOD? So usually, as I said, it started with the periods irregularity, but definitely that thing to be kept in mind, that period irregularity should not be like a within a 1 year of her period. If the irregularity happened, apart from that other things are nothing not there, then you should not worry about. But definitely, if other parameters like excessive hair growth, darkening of a skin of underarms, or darkening of a skin of groin or a neck is there, then definitely you have to visit your doctor. At that point, we used to just go for the checkup, like the ovulatory dysfunction we have to check. Androgen is the hormonal excessive hormone is there or what. For that, we used to investigate a patient by doing a biochemical markers like a blood investigation, hormonal profile, and simultaneously we used to take a few history and the examination of a patient, by that we can able to say yes, she is having a PCOD or not, or it's just a simple normal adolescent irregularity of a periods. So for all these things, patient should have completed at least 2 years of after menarche. And then if she is visiting, even after that her cycle is not regular, then definitely she needs a treatment and she needs a further investigation. What are the other symptoms which you should expect apart from all these what I said? Apart from that, if even the cycle, if she doesn't have any kind of symptoms like a loss of hair or darkening of her skin, but her even after 2 years of starting of her periods, her cycle is like erratic. Every month it's coming every two every well, not less than the 21 days or not more than the 40 days of period. So if it's there, that means she's going through some kind of the hormonal disbalance. And usually these kind of thing patient used to present with the excessive bleeding, like the bleeding started, period started, but she is not that period lasts for more than 2 to 8 weeks. And because of that reason, sometimes the adolescent girls used to go into anemia. That is a lack of hemoglobin, and the lack of hemoglobin itself causes multiple problems in manner of too much of sluggishness. She will be more sleepy, lazy, and all. So these are the things which you had. This is alarming thing for a mother, which she should not. Usually what happens most of the time, we used to scold our child that she's not active, she's lazy, but we have to find out a reason why she's becoming a lazy. It's because of the excessive weight gain, or it's because of the lack of hemoglobin. So in all cases, we have to find out the reason and we have to treat. That is very, very important. So now if coming to the treatment, most of the time in these girls, they didn't require a hormonal treatment. For all these girls, we used to start a treatment with a lifestyle modification. As I said very initially only in my talk, this is a lifestyle disease and it's increasing day by day because of our lifestyle. So nowadays the lifestyle starts with a lack of sleep. That is one of a very, very important thing. You have to see in your kids, is it there the sleeping hours are normal? what do you mean by the normal sleeping hours? That means sometimes the kids say, yes, I used to sleep for 9 hours. When we used to ask history and and what is your sleeping time and what is your wake up time, they used to say my sleeping time is like 1 p.m, 1 a.m or 2 a.m midnight, and I used to wake up by 10. So these are the things which is also very affecting, much affecting our lifestyle. Because as per our Indian scenario, our body clock, our biological clock is not fit for that. And because of that reason, so the sleeping pattern itself causes multiple hormonal disturbance in a body, and that itself causes a problem. So these are the small things which should be very much observed and to be taken care by all mother. So apart from that, what are the other things which you have to take care? So if anything, like food habits is another important factor. Although the awareness, for this awareness is very much, all the schools and everywhere they are causing awareness for these all these reasons. So definitely all the junk foods, whatever the food we used to eat, whatever the drinks we are taking, apart from that, even we are having a healthy food, so these all foods are just coated with the pesticides, and all these all are again a responsible factor for the adolescent PCOD. So you have to take precaution in manner of, you should avoid packaged food. That is very important. So nowadays you see, the more the expensive items, the more it used to be packed, and it used to be packed in like a container, like a plastic itself is a very harmful thing. So we are using in every day to day activity, we are using a microwave for heating of our that food products. That itself is not good, and it causes a harmful effect on our body, on your hormonal system. So you simple words, you have to be go in your back, in your that historical thing, on your basic, the whatever our grandparents and our that family, we used to just born and brought up like after in our 70s or 80s, that thing to be followed again to keep yourself healthy. So like small things like avoiding a plastic things, plastic container, plastic water bottles, the lunch box which we are using, that used to be a plastic. So avoiding a plastics, to use the steel or the glass products, these all are a safer things which you can do. So these are the small things you can do. Even apart from that, the timing of a diet is also very important. At what time you are taking what meal, that is important again, because that hinder your insulin and insulin level, all the insulin production in your body. If you are taking a starving yourself, you are not taking your breakfast on time, you are not taking your another meal on time, that itself causes a problem. And this, all the insulin resistance develop and causes a obesity, and that one cycle used to established in form of insulin resistant obesity, and the later on the all the hormonal environment happen, and you will land up with all the problems which I just now said. So these are the things which you have to take care. Apart from all these things, the exercise, role of daily exercise is very important. Role of exercise is there, and if you are everyday basis, even if you are sparing a 30 minutes or 15 to 20 minutes of time for your exercise, that is very good for you. So your kid should go for any kind of activity. It's not necessary she should play, it's not necessary she should do the gymming, but the thing is the cardio exercises in form of a brisk walk, in form of a cycling, in form of aerobics, whatever your child like most. If she is playing, that is very good, but if she is not playing and she is going for a dance class, that is also a kind of exercise, but it should be in on a regular basis. And every day 30 minutes per day, at least 5 days a week, is a very important. And these all whatever I said itself is a part of a treatment for all these PCOD, adolescent PCOD patient. So without giving any kind of treatment, by doing all these things, we can reverse the things, and the patient used to be absolutely normal, and it can be. But definitely, if the once the girl is diagnosed with a PCOD, she has a risk of all the PCOD throughout their reproductive age group, so she should be careful. It's not like, today you are a PCOD patient and within 2 years with all these corrections and the medication or the lifestyle, the things are gone, now you are okay. It's not like that. Is the only drawback of this disease. So you have to be careful about all your precautions throughout your life, and then only you can prevent, and you don't need any kind of medication. But in some cases, even after the lifestyle modification and all these, adolescent girls need some medication. So these medications usually we preferring a non-hormonal medication, which is because at the age of growing age, adolescent age, we don't prefer giving because of the fusion of bone is not happen, which is hampering the things. That's why you don't prefer. But sometimes in excessive or the severe cases, like if the patient is bleeding, the girl is bleeding for a longer time, not able to control a bleeding with the non-hormonal products, then definitely we used to give. Otherwise we usually don't prefer giving a hormonal things, and we used to prefer giving medicines like NSAIDs, tranexamic acids, few group of medicine, and if required, the progestins. So these things are required, and if according to the patient's conditions, we used to treat. Most of the time we used to land up with a PCOD related anemia, because the patient is a PCOD patient and she used to bleed in every month heavily. Because of that, the slow process, she used to have a lack of hemoglobin, and she used to have a that anemia during their adolescent. So because of anemia, as I said, itself causes multiple problems, multiple symptoms like a lack of concentration, loss of hair. So these all things happen. So then not able to lose a weight. If somebody is thin, the thin adolescent PCOD, then she is not able to gain a weight. So these are the things which is happening. So we have to correct the anemia itself while during their treatment. So these things are required during their adolescent PCOD patients. Apart from that, what are the things you have to keep in a mind when your child, even your the young child, she is not having any kind of menstrual irregularity? Still, you have to keep things in your mind. Ki she should not land up with all these problems. So you have to control their lifestyle as well as a diet, as well as their, you have to maintain a menstrual calendar of that girl. Most of the time these young kids are not aware about how frequently, especially nowadays the menarche happen very early. So it's usually starts, the age in India is 11 to 13 years. So sometimes even the 10-year girls used to have a start their periods. So this small kid is not aware about how much bleeding should be there and how much it is. It's a duty of a mom to take care of and take a ask her questions, be in touch, be empathetic with her, and ask her what kind of bleeding she is having. Is there the thing? And on top of that, since very beginning, you have to maintain her menstrual calendar and make a habit of maintaining a menstrual calendar, which is very important for any girl. Then only you are able to keep a watch how frequently she is having bleeding. Sometimes the patient used to come, but they are not aware about the previous history of menstruation. So how frequent it was, how much the length of her last cycle. So that is again an important thing. So this message is for adolescent girl as well as a mother, to ask her to keep a track of her periods. Nowadays so many apps are available, you can just keep a app and you can just keep a track of your periods. So by this way, you will be able to understand whatever I said just now, at which point I should go to doctor. Is it now the time we should go to doctor? Otherwise it will be very difficult for you to keep a track. Only you will land up in clinics when you will face a difficulty, which is that severity which will be happen because of a complications of all these problems. So this is what I'm going to try to tell and through a message. So you have to be very very careful about your diet, exercise, and the lifestyle. To by doing all these simple things, we can prevent this adolescent PCOD, which is a very very crucial thing is in later part of life, and usually the girls used to neglected at this part. Then only they used to land up with the major problems like obesity, infertility, and all these excessive hormonal disbalance causes the metabolic problems, the more chances of going towards that diabetes, hypertension. So these can be easily avoided just to take care of all these precautions. This is what I am trying to tell today. So hope all these things will be helpful for all. And any kind of question, it's I all just happy to share whatever you want to ask. Thank you so much. Any questions? So I can't see any question on my private chat. So thank you so much for your all this, and hope all the my talk will be beneficial for all of you. Thank you so much.